Hi, everybody, and welcome to Cope with Hope. Today, I have the financial whiz kid and financial expert, Ajit Dayal, who's going to be speaking to me. I mean, we're all family friends, and his sister is one of my closest and dearest friends. And she says about him that he is the most caring, giving, magnanimous, sharing brother that anybody could have. And I know he takes this into all areas of his life. So when I read the other day that in July, 5 million salaried jobs went in India, I just thought of, okay, fine, this is India. What about globally? What must have happened? And the only person I know who will be able to tell me something in a very broad perspective would be Ajit. So I requested him to come and talk to us about what sort of impact that's going to have on us as individuals, on us as a country, and us as global citizens. And Ajit, would you speak in very layperson's terms? Because I don't understand economy that well.
Sure. Thank you, Nandini, for having me. You mentioned this is your 103rd episode. So I was just telling you that if this is 103, then you're lasting a lot more than the virus is. You're like they're going right through. The virus doesn't last that long. Anyway, but thanks for the introduction and thanks for having me on it. I'd like to clarify one thing: the finance whiz kid part is wrong. The kid part is certainly wrong. No longer a kid. Anyway, that's for sure. So a few things. Kind of step back a bit, right? So in the field of finance, we have a phrase which is called the black swan event, and a black swan event is something which is unexpected. Like, how often do you see a black swan? It's one in whatever 782 years of the last spotted, whatever it is. So a black swan event is something which is supposed to be unexpected. The pandemic and COVID-19 is not unexpected. The world has witnessed a bunch of other viral outbreaks in the last decade alone, roughly. So 2003, you had SARS, which again came from what Donald Trump would love to call the China virus, but came from China and it kind of spread around the world. Now, in 2003, the world was a lot less integrated than it is today in the year 2020. And so the spread of the virus was relatively contained. You did not have, for example, Chinese tourists were not flying around the world.
Yes.
In 2019, the Chinese tourists are the largest and the most populous tourist body traveling all over the world and the biggest spenders. Yeah. Right? So the hundreds, maybe about 100 and something million Chinese leave China every year for a vacation, which was certainly not true in 2003. So because virus gets spread by people, so the fact that there are more people traveling and there's more trade, and trades means goods, and goods means there are factories, and factories means managers travel, employees travel, etc. The pace and the ferocity, the sort of velocity and the ferocity of this virus, the ferociousness, has been a lot more intense than SARS. So that's one thing to recognize. This is not the first time we've had a virus. We also had the H1N1 virus about 6-7 years ago, and it kind of spread around the world, didn't do much, and everyone kind of forgot about it. And then, of course, you've got the more dangerous HIV virus, which has had its own impact. Yeah. So the point I'm making is that policy making and governments and us as citizens of any government in the world, any country in the world, we should have been watching one indicator. And that indicator was how much money are governments spending on healthcare for the next virus, right? So 2003 SARS, you had a dangerous virus, which was killing roughly about 20 times more people than this virus kills and spreading quite easily. And so if you were policymakers in the world and if you were concerned citizen, if democracy and corporate governance in a countrywide sense had worked, governments would have been spending more on healthcare, more on preventing how the future damage from such a virus.
Yes.
So we failed miserably on that.
Miserably.
I gave a talk to a bunch of doctors from US, England, Europe, India a few months ago, and I'm giving one more in October to bring this financial angle to what they're seeing in the healthcare system. And I asked them questions like, for example, tell me the number of hospital beds. And of course, this data is available, but I wanted them to give a sense of hospital beds per 10,000 people in their state, in their country where they're practicing. And over, say, 2008-9, because that was the last financial crisis we had of this scale. So when Lehman Brothers went bankrupt, etc. So between 2008 and 9, McDonald's and Starbucks, as two companies, have spent more money opening opening up their franchises around the world than all governments have spent on healthcare. Absorb that. So you're out there breeding and feeding consumption patterns with McDonald's expanding in India and China and Africa, wherever they expand, which is fine. It's their business plan, as is Starbucks. But the amount of money they've spent in expanding McDonald's stores to make it easier, since I'm guessing you don't eat meat, to order your veggie burger, or for me to order my beef burger, much as my prime minister may not like it, whenever I travel, once in a while. They've spent more money on that than governments have spent on building hospital beds. Now, to put that in numbers, so to give you sort of one example, that the U.S. economy prior to COVID is roughly about if you look at the global GDP, the U.S. is roughly about 28%, 30%, about a third of global GDP. What that translates to is that the US economy contributes in dollar terms, and I'm going to use dollars and trillions for a while. It contributes roughly about $15 to $16 trillion in global GDP. The cost of adding 100,000 isolation beds in the US, the cost of adding, the medical staff that goes with it, would have been something around the tune of 10 billion. So if you take 15 trillion and 10 billion, you're talking about fractions of percentages, decimals. And even if you add the cost of training nurses and doctors and everything else to maintain that, it works out to 0.4%. So it's like buying an insurance policy, right? All of us, so many of us, have life insurance and health insurance. You pay a premium because just in case something happens to you and you go to the doctor, then you have your medical insurance to pay all, if not most, of your bills. In a very similar way, governments and policymakers around the world, including India, fail to pay that insurance. So healthcare is insurance, right? Now, whether it may be preventive, so whether it's yoga, meditation, and eating healthy, which is preventive, or whether it's curing, you have the hospitals where you come to and you have the nurses, etc. So either way, if the US had spent 0.4% of its GDP, so out of every $100 that gets produced in the US, if 40 cents had been spent, 40 cents had been spent on healthcare, for all these years, you would not have this collapse of roughly 20% of GDP. So you've lost $20, including lives and pain and the distress, for not spending 40 cents. In the Indian context, the numbers are a little more different. In the Indian context, for 100 rupees of GDP, of output that we produce as a country every year, if the government had spent 1.6 rupees, we would not be in the mess we're in today. Because when you have more hospital beds, when you have more nurses, when you have more doctors, you have more IV fluids, no matter what the pandemic is, you've got the capacity. So you may have heard the phrase flattening the curve. Right? The flattening the curve was a basic idea, and a sensible idea, which said that, look, we have this unknown virus in the month of, when it hit Western Europe in February and March, when it came to Italy, Spain, etc. We've got this virus hitting us. We don't know what's happening. People are coming to the hospitals. We have no clue what to do. There's no space in the hospitals. And patients are dying for a bunch of reasons. They're dying because either there's no space, so there's no bed to give them, and they're dying from poor hygiene or lack of care, or there's not enough doctors. And some of the doctors, and I was told this by people in the medical fraternity, that, for example, people in the cardiac divisions were suddenly asked to come and use sort of the respiratory machines on patients, and they had no idea what to do. And so some of the people could have died because of human error. And on the other hand, the virus is so new, you don't have any sort of medical treatments for it as yet. So the flattening of the curve was stop allowing people to rush to the hospital. And the way to do that is sit at home. So we came with the lockdown idea, right? So
yes.
that's the connection between the lack of insurance, of spending that 40 cents for every $100 in America versus 1.6 rupees for
In
every
India.
100 rupees in India. You have this massive dislocation. And, there's also massive human cost. This is all economic cost lockdown. But look
Yeah,
at the human cost. Look at the
yeah.
relationships. Look at people who've lost parents, lost children, can't see them, can't attend their funeral, can't attend their cremation, can't hug your children. I mean, it's insane, all
It's
this stuff.
insane. Yeah,
So this black swan event, firstly, was not a black swan event. It was to be expected.
yeah,
And we were totally caught, we were totally caught naked. I mean, there was no
yeah. Not
preparation
even pants
for
down,
it at all.
naked. Yeah. Do you know our medical
Absolutely. So,
system in Bombay is the same as it was 30 years ago? It's
yeah,
not
correct.
changed. How can that be, Ajit? How?
So, well, it's a lack of apathy and understanding. I mean, I've heard people who've been on your program. I saw a few of them, and for example, you talk about Bombay. There's a massive scandal in Bombay. I've done a couple of videos on it, but it's not
Yes,
gone viral. And
coastal.
it was about the lack of investing
Okay.
in hospital beds in Bombay. So what the BMC has done or had done for the initial few months, we're all sitting at home, we're locked down, and the idea of the lockdown is to build hospitals, build new hospitals.
Yes.
China did that, Korea did that, Japan did that. Our brilliant BMC, what they did is they're building a coastal road which
That's
runs
it.
outside the Breach Candy Hospital,
Yeah.
and they're spending 5 crores a day still till today on probably what is an illegal coastal road, which is going to flood the city of Bombay. And in the meantime, that 5 crores could have been spent on building new hospitals. They did something at the NSCI. They took over the Wellington Club. They've done a few things. But what they really did was go to existing hospitals, say, you know what, your hospital now belongs to me. So
Yes.
they did not add new beds. They just took
No.
over capacity
Yes.
from something else to the COVID. So, it's a complete failure. I mean, the BMC is a disaster, and someone should do a kind of a complete expose on what's happening there. But that's another discussion. So, to get back to the point about flattening the curve, you've also flattened the economy in the process. And
Yes.
flattening the
Yes.
economy has resulted in, we saw the migrant labor. You saw,
Oh,
8 million people from Bombay, Delhi, etc., getting stuck, not
yeah.
able to leave from where they were,
Yeah.
walking home. You saw all those horrible images and horrible stories. And there's some recovery because when a migrant labor goes back to the village, and luckily, in terms of timing, we've got the sowing of the crops going on now. So
Yes.
when the migrant labor reached back to their villages in, May, June, July, they can actually help the families, with the
Yes.
sowing, work on the fields. But
Yeah.
that's over. Now that the next thing is now they all want to come back.
Yes.
So the job losses curve, which you spoke about, was huge. There was a massive spike in April, May as people were finding their way back. And
Yeah.
then as they sort of gained, not gainfully employed, there's an economic term for it called underemployed. So if there are 4 people in your family who were doing the field, and now you've come from Bombay or Delhi, back to Bihar or UP, and you help in the field. So you've
Yeah.
not really added because the field is still the same and is going to get done. It
Yeah.
just took more people to work on it. So
Yeah.
it's not unemployment, but it's not quite gainfully employed. It's not really adding to anything else. You're just doing that same field which 4 members could do, and now 6 members of the family are working on it,
Yes.
right?
Yeah.
So, but in small shops, obviously the shops were closed, the malls were closed, the small businesses, the
Yes.
corner stores were closed. So that's been a huge hit. Restaurants, hotels, airlines, worldwide, going back to that, roughly 20% of all jobs in the world are linked to tourism. 20% of the worldwide jobs. Now, airlines, cruise ships, hotels,
Yeah.
museums, you name it. I mean, everything is devastated and no idea when it'll return and
Yeah.
what shape or form it'll return in. So there will be a significant, loss of permanent jobs in some sense, or a permanent loss of jobs around the world because of tourism. And India is a small tourist destination. We get fewer tourists in India than, for example, Singapore does, right? And with that comes everything else, whether it's a casino or the malls or the shopping. I mean, everything. There's a whole chain reaction
Yes.
to it. So we are, as they would say, in uncharted territory. too many unknowns over here. And
Too
to take
many.
a line from E. Cummings, it's like the unknown passing through the strange. And we
Yes.
don't know where we're going to end up when this is over.
Yeah. Is there any hope for us? And what you think hope is?
So life's going to change. I look at my own life in some sort of ways to map it. I have family in Bombay, that's home. I grew up there. I have children who study in Switzerland, in Zurich. They're adults, but they study there. And I have a lot of affinity with Florida, where I used to live and work for many years. So I kind of look at my life, spreading across 3 continents, traveling pretty much at will when I wish to. Now to get on a plane for a 10-hour trip, from London to the US, or 10 hours from London to India, or 9 hours from Bombay to Zurich, and 20 hours from Bombay to Florida, forget it. I mean, it's kind of a scary thought.
Yes.
So I think, and but particularly if you have, like, as I do, have a bit of asthma, so with the comorbidity, as they call it, you have to be even more careful. But I think life will change for the elderly people. My own personal view is, and that's why I'm not with my children, I believe that the younger generation should go out. Believe they should live a normal life as much as they can. And if it means that they see less of their parents, so be it. And I think we have to be, if you're above a certain age, you have problems, you have to be more careful. So you be more careful. So I've not hugged my children properly since March. Even now, whenever I see them sporadically, it's, light hug. And then, of course, you go wash your hands for, like, not 20 seconds, 40 seconds, have a shower and stuff like that,
Yeah.
So
Yeah.
that's the new norm.
No.
I mean, so all the meditation that you're learning and teaching will come into practice, that it's the mind has to be at rest, and the physical hug is kind of gone in some sense.
Yeah.
So it's going to be a very different world, very, very different world, I think. And people talk about a vaccine. Okay, the vaccine may come out, but there could be another pandemic, there could be another virus. This virus itself could morph into something milder, or morph or mutate, whatever the phraseology is that the medical terms people use. But it could change, it could evolve into something worse or nicer. And the extremes could be, you've got SARS, or you have MERS, which is the Middle East respiratory syndrome, which killed about 1/4 of the people that it infected. Or you could have the common cold, which doesn't really kill anyone. So the virus could mutate in a whole range.
Yes.
And so I think that to me, the more than the vaccine is the treatment. If the hospitals and the medical establishment can figure out, like, if you get a bad stomach, you take Imodium, you have fever, you take paracetamol, so if they can work out some sort of protocol on these set of medicines work for these category of people, then you're okay. Then you can travel and take the risk. Sometimes you want to eat that chaat on the road, but the food is
Pani
not
puri.
quite pani puri, and you get an upset stomach, but there's Imodium, so it's okay. So you want to go to Florida, you want to go to London, you're in India, you want to go somewhere. Okay, you take the plane ride, knowing at the other end you get something. I can take an Imodium and I'm fine, and I'll be cured of COVID. So if you can come up with a cure, that to me is far more powerful than a vaccine.
Because my doctor says the same thing. Yeah.
Oh, really? Very good. I'm not a doctor, but I'm a doctor's son, so I'm kind of a semi-quack.
Yes.
So helps.
I agree with you. Rather than a vaccine, we need medicine. That's the cure.
Yeah. And you need to be sensible. I mean, you have to realize that it is, even once you get the cure, it's not going to be fun if you get this, and it can have long-term effects on you. And there is certain. So I remember the first week when the COVID was out, was spreading like wildfire. I did a quick analysis of my own. I'm in finance, so I love doing risk. And so people think of finance as a place to make returns, which is true. Investments is actually about controlling your risk. If you control your risk, means if you lose less money, you automatically have more money to make more money. Right? So it's more about controlling risk. So therefore, probabilities of losses are more important, in my view, than probability of return. You always know your expense. You should know your downside. You never know how much you're going to earn. No one can predict that. So I did a probability of so many things. I said, okay, if you're flying in a plane, which I do multiple times in a year, used to, what's the probability of dying in a plane crash?
Oh,
it's
Bhagwan.
1 in 5 million. No, it's
Okay.
1 in 5 million. These are statistics you should know about.
Okay.
It's 1 in 5 million. If you're crossing the road in a busy city like Bombay, Calcutta, Bangalore, Delhi, Dhaka, Sri Lanka, whatever, it's 1 in 500 of death. So one
Wow.
in 5 million, right,
God.
on a
Yeah.
plane crash, of being on a plane,
One
one
in
in
500.
500 of crossing a road.
Yeah.
And if you have asthma and you get COVID, the probability of death was 1 in 20, right? So you've already got the asthma part, now you got to stay away from the COVID.
Yeah.
So I remember when I came back, you spoke about my sister, Mala. So I didn't meet Mala. I mean, she thinks I'm
I know.
crazy when I first landed from Europe to India, even
Yeah.
though COVID was not a pandemic as such, well, had not spread to India in that sense in March. I just self-quarantined myself for 2 weeks.
I
I
remember.
didn't leave the house.
Yeah.
And then my sister came to stay at my place. And
Yeah.
again, I didn't see. I said, 2 weeks you quarantine,
I
2 weeks I
remember.
quarantine.
Yeah.
Yeah, and she thought like, what's this guy about? No, that's the only sensible thing to do. And then when I was leaving, I kind of literally at a distance of about 20 feet, I waved out to her, said bye, and I left the house. So, that's life. That's the way you have to now behave or think. It doesn't diminish the concern or the love you have for the other person. But
No.
there's a reality that the virus jumps through people. So if the virus jumps through people, you have to avoid meeting too many people or be careful who you meet. You know.
Very well said, Ajit. And your sister thinks you're the most caring person in the world. So, Ajit, what do you feel about the fear that's been sort of embedded in everybody, and about people shouldn't do this and shouldn't do that? What is your opinion about this?
So, clearly when the virus first hit the Western world after coming out of China in Jan Feb, there was fear because no one knew what was happening. Now everyone's understood what it is, but governments are still using fear to control people. They're still using the media to scare us, to give us fear. It is. So governments around the world, and particularly in places like India, are suppressing us. And we're willing to be suppressed because of the fear we have.
Yeah.
But we have to make a distinction between fear, between being sensible, which is meeting people, having interactions, but having a distance between them, washing your hands, and being silly.
Yeah.
So the young can be silly, and the young should be silly. It's their life. They should go out, they should have fun, they should hug each other. They want to go to discotheques, casinos, that's fine. Let them do that. The collateral damage, of course, in that sense is that because the young people have parents or uncles, aunts, and they may be sharing homes, there's a risk. So
Yeah.
the sensible parents will probably say, okay, I'm going to let my kids do this and I'm going to move out. Or
Yeah.
I'm going to go somewhere else.
Yeah.
Right. And the governments, of course, are putting all this fear on us, showing all these rising numbers and saying, hey, sit at home, stay locked down. I may lock you down even further.
Yeah.
You can't go out. And they can do all their dirty work and all their terrible work by deflecting this fear in some sense. The death rate of this coronavirus globally has now fallen to 0.5%. So it was 8 or 10% when it first hit because no one knew what to do. Now it's 0.5%. Out of every 100 people who get it in the month of February, March, 8 to 10 were dying. Now, out of every 100 people who get it, half a person is dying. Right? So that's a big thing because now we know
Yeah.
what to do. There's doctors are there, there's medication, there's hospital beds. The curve has been flattened. But the government doesn't tell you that. They
No.
still want to lock you up so they can do bad stuff behind your back, or rather in front of you. You can do nothing about it. You're locked up. So people have to be balanced between fear that they have, being sensible, for me and other people who have comorbidities and
Yeah.
are older, and also being silly for the young. Let
Yeah.
the young be silly, and that's my view. The other thing is that maybe this is nature's way of telling us that we've been using medicines for too long to stay alive, and we have to bring our longevity age down to another, to a prehistorical level in some
Yeah.
sense. So
Yeah.
yeah, so I think there's a little balance that has to be done over there. I don't think you should live with fear at all. Recognize that 99.5 people out of every 100 who are going to get this are going to come back home fine. And
Yeah.
zero point 0.5 are not going to make it or are going to have illnesses that may last for some time.
Yeah.
And so don't have fear, but be sensible, of course. And if you're young, be silly, but recognize the impact on your parents or uncles or aunts or household, as most of us live in joint families or, with our parents at home
Yeah.
in India.
Okay. Thank you. And there's your hope.
There's
be
the hope.
sensible,
Absolutely. Cope with the hope.
cope
Absolutely.
with the hope. So this is the hope in all
This
this,
is the hope.
you know.
Yeah.
And I think
Absolutely.
that's what keeps us human beings going. It's that constant hope, you know. Thank you so much for giving me your time. And I hope you've
Thank
all
you.
learned something lovely from what Ajit has said. And I do hope you come on again and tell us some more of your, share some more of your wisdom with us. Thank you.
Thank you so much, and see you soon. Bye.